Generalized anxiety disorder. As presented in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, otherwise known as the DSM-5. Anxiety disorders share features of excessive fear and anxiety. Fear is the emotional response to a real or perceived imminent threat, whereas anxiety is anticipation of future threat. To help understand the difference between fear and anxiety, it's helpful to think of fear as autonomic arousal, i.e., fight or flight, and anxiety as vigilance over anticipated danger. Anxiety disorders differ based on the objects and situations that induce fear, anxiety, or avoidance behavior. Generalized anxiety disorder is characterized by an excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities such as work or school performance. People experiencing generalized anxiety disorder find it difficult to control the worry. Their anxiety and worry are also associated with 3 or more of the following 6 symptoms, with at least some symptoms having been present for more days than not for the past 6 months. Restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension or sleep disturbance, difficulty falling or staying asleep, or restless, unsatisfying sleep. Associated with muscle tension, there may be trembling, twitching, feeling shaky, and muscle aches or soreness. Many individuals with generalized anxiety disorder also experience somatic symptoms such as sweating, nausea, diarrhea, and an exaggerated startle response. Another criteria is that the anxiety, worry, or physical symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. These disturbances must not be a result of the use of drugs or medication and is not better explained by another mental disorder. Females are twice as likely as males to experience generalized anxiety disorder, and the prevalence of the diagnosis peaks in middle age and declines across the later years of life. 1/3 of the risk of experiencing generalized anxiety disorder is genetic, and these genetic factors are shared with other anxiety and mood disorders, particularly major depressive disorder. It is necessary to differentiate generalized anxiety from other types of mental health disorders. Differential diagnosis can include medical condition, substance medication induced, social anxiety disorder, obsessive compulsive disorder, post-traumatic stress disorder, depressive, bipolar, and psychotic disorders. Diagnosis of anxiety disorder associated with another medical condition should be assigned if the individual's anxiety and worry are judged based on history, laboratory findings, or physical examination to be physiological effect of another specific medical condition. Substance medication-induced anxiety disorder is distinguished from generalized anxiety by the fact that substance or medication is judged to be etiologically related to the anxiety. For example, severe anxiety that occurs only in the context of heavy coffee consumption would be diagnosed as caffeine-induced anxiety disorder. Individuals with social anxiety often have anticipatory anxiety that is focused on an upcoming social situation in which they must perform or be evaluated by others, whereas individuals with general anxiety worry regardless of being evaluated. In obsessive-compulsive disorder, the obsessions are inappropriate ideas that take the form of intrusive and unwanted thoughts, urges, or images, whereas in generalized anxiety disorder, the focus of worry is about forthcoming problems. Generalized anxiety disorder is not diagnosed if anxiety and worry are better explained by symptoms of post-traumatic stress disorder. For example, one of the diagnostic criteria for PTSD is exposure to actual or threatened death, serious injury, or sexual violence. Generalized anxiety is a common associated feature of depressive, bipolar, and psychotic disorders, and should not be diagnosed separately if the excessive worry has occurred only during the course of these conditions. For more details on generalized anxiety, please see the DSM-5, and thanks for watching.